بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين. Today we reach the last lecture about the adrenal gland. In this lecture we are going to talk about disorder of adrenal medulla. The lecture will be presented by Dal Ibrahim, Assistant Professor of Clinical Chemistry. Outline: in this lecture we are going to talk about definition of pheochromocytoma, symptoms and signs, and laboratory diagnosis. What is a pheochromocytoma? Is a neuroendocrine tumor of the medulla of the adrenal gland originating in the chromaffin cell, the cell of the adrenal medulla, or extra-adrenal chromaffin tissue that fail to involute after birth and secrete excessive amount of catecholamines, usually adrenaline if in the adrenal gland, and not extra-adrenal, and nor adrenaline nor epinephrine. So pheochromocytoma is a tumor of the adrenal medulla to produce more catecholamines. 17% of adrenal causes are bilateral, suggested hereditary disease. 18.4% in children, also suggesting hereditary disease. 5% are extra-adrenal, located in any orthosympathetic tissue. Of these, 9% are in the abdomen and 1% are located elsewhere. Some extra-adrenal pheochromocytoma are probably actually paragangliomas, but the distinction is only possible after surgical resection. So, pheochromocytoma can be in the paragangliomas. 11% malignant, but this rises to 30% for extra-adrenal cases. 26 are hereditary. 3% recur after being resected. So after we remove the tumor surgically, the tumor in 3% of cases can be recured. 14% of affected individuals do not have arterial hypertension. Here looks at the extra-adrenal site of pheochromocytoma. Number 1, within the sympathetic nerve chain along the spinal cord. This is orange spots overlining the distal aorta, the main artery for the heart. This can be presented by green color spots. Number 3, within the ureter collecting system from the kidney. This is present or presented by yellow spots. Within the urinary bladder, blue spots. And remember that 90% is in the adrenal gland, which is represented by red spot on the kidney. Signs and symptoms of pheochromocytoma often include high blood pressure, headache, heavy sweating, a rapid heartbeat, tremors, balance in the face, shortness of the breath. Diagnosis of pheochromocytoma: demonstration of significant catecholamine excess, level of catecholamines and their metabolites in either urine and blood. Catecholamines metabolite include methanephrine, norepinephrine, dopamine, and phenylalanine mandelic acid (VMA). So when we measure these hormone and their metabolites and found them high in the blood sample or urine sample, this is the indication of pheochromocytoma. Catecholamines vary throughout the day, so the best method for diagnosis is 24-hour test. Because of variation during the day, sometimes it is increased and sometimes it is decreased. To avoid this condition, we measure the sample in 24-hour urine collection. The result is positive if catecholamine level exists 2 times the upper limit. We say that this patient is have pheochromocytoma when we measured the catecholamines and found them rise more than 2 times of the normal upper limit. Plasma-free metanephrine is followed by frequent false positive result. For this reason, 24-hour urine testing remain the standard goal. In some laboratories, we measure plasma-free cortisol, but this test is influenced by many factors and give false positive result. So the 24-hour urine testing remain the gold standard. This is all about pheochromocytoma. Thank you for good listening.